This question deals with a 45-year-old Hispanic female presents to your office for the first time as a new patient after recently moving into your community. Her medical history includes obesity, type 2 diabetes. Her current glycosylated hemoglobin level is 10%. She has been using insulin in addition to oral hypoglycemic medications for the past few years. When you ask her how she is doing with her insulin, she replies, and this is the most important sentence of the question. She says, I use it once in a while, but I feel fine, so I don't think I need it. Which of the following is the best reply? Now, before we even explore the option, let's see what she says one more time. She said, I use it once in a while, but I feel fine, so I don't think I need it. The patient thinks she does not need the drugs. She does not need the insulin drugs to keep her sugar level in control. I can, maybe presumptively think that she does not understand how diabetes work or how the diabetic drugs work. Or I could just be, as a physician, we could just be presumptive. So the best thing to do is pause and understand here what the patient is thinking. If she's saying she feels fine and she doesn't think she needs it, there is a problem in understanding. Or I think, or as a physician, we should think that she must not understand the use of those drugs. So the question should be something like, okay, so what do you understand about diabetes? Or what do you think, how do you think you can better your health? Something like that, an open-ended question, but directing towards the fact that I want to know more what you think about diabetes, right? So that should be our train of thought. So choice A says, your blood sugars are not well controlled. You should use insulin regularly. I'm sure her previous doctor, she moved in here recently, I'm sure her previous doctor had told her to, her previous doctor told her this. She still thinks she feels fine and she doesn't need it. Okay, so that is probably very, very ineffective, because if her previous doctor told her and she did not listen, then she must have some new thought in her brain. So that statement is completely ineffective. So that's not what we should be saying to our patient. Choice B. It seems that your blood sugars it seems that your blood sugar are not well controlled. Do you have difficulty injecting insulin? This could be a potential answer. But then again, I'm thinking, is this what, she does not complain that injecting insulin, she does not express any distress about injecting insulin. She talks about how she feels fine and she doesn't need it. So even this seems like a logical choice at this point. There could be a better option than this one. Choice C. It seems that you have little understanding about diabetes and its complications. Let me explain more about it. Saying that you have little understanding about diabetes and its complication, it is kind of putting the patient down, and you might make the patient defensive. So you want to get to the patient without offending the patient. If you're offending the patient, would you think the patient is going to listen to you? I don't think so. I mean, they'll be like, screw that doctor, I don't need his help, right? I'm just going to do whatever I am doing. So let's see, we want someone polite, we want someone effective and polite. So let's see choice D. It seems that your blood sugar are not well controlled. Okay, so you are confirming that with the patient. I think there is a problem. It seems that your blood sugars are not well controlled. Please tell me what you understand about diabetes. So here is that open-ended question I was talking about, encouraging the patient to talk about what she understands about diabetes. I cannot imagine a better statement than that in this particular scenario. So I would have picked choice D. But let's see choice E anyways. Since you are not using insulin regularly, I'll add more oral medications and cut down on your insulin. This is threatening. A threat never works, or it's the least effective way of treatment. You should not be using threat. You should encourage the patient to be open and encourage the patient to kind of, bring it out of the patient what they need to have their condition under control.